what I was taught in medical school, I distinctly remember this. So this was the early 90s. And when I speak of this, and if I have physicians in the audience who have some gray hair like me, they often nod because they had this same experience. I remember being taught, don't care too much, because too much caring, too much compassion burns you out. And Suzanne, I believed that dogma without ever questioning it for 25 years, until I was in the throes of burnout myself. And I went to the available evidence, and imagine my surprise when I found that where opinion and once reigned conjecture, now there was actually bona fide research. And what the research shows quite clearly is there is an association between compassion and burnout. And this isn't just in healthcare, but just broadly across psychology and multiple different interdisciplinary scientific domains. There is, in fact, an association, but it's inverse. It's inverse. So if what I was taught in medical school was true, high compassion, high burnout, and low compassion, low burnout, but what the evidence supports is inverse: high compassion, low burnout, low burnout, high compassion. And why? What our research over the last 5 years, essentially, if there's one thing we learned, it's that the key to resilience is relationships. And so if you care deeply about patients and their families, or also like the staff, the nurses I had worked with in the ICU for, at that time, 15 years, and even at home, and leaning in rather than pulling back and detaching, and caring more, not less, and doing it very much as an intentional practice, I had these deepening of these relationships that flowed from that. And that was when the fog of burnout began to lift for me.